Okay, and for everyone who is just watching this, can you just say and spell your first and last name and explain, like, your position?
Dr. Payal Kohli, and I'm the verified medical expert.
Awesome, great. So we are talking about this magical drug that, I've seen so many articles on. They say it's the celebrities are using it. It's used mainly for people who do have diabetes. But do you want to explain, kind of what the drug is and what it does?
I'm kind of glad that you called it magical because many physicians are also sort of referring to it as a paradigm shifting drug. It's changed the way that we think about obesity. So the drug is a class of drugs called GLP-1 receptor agonists. And there's also a drug that's a GLP plus a GIP. Now that's very technical, but essentially what the drug does is it changes the way that your body responds to food. It changes the feelings of satiety and it changes the hormones that are released after you eat. So the drugs were initially designed as diabetic drugs. In fact, they were studied in diabetic patients to help reduce blood sugar by changing the way the insulin is released after you eat. But what they found out in the clinical trials was that the diabetic patients taking the drug that were obese just had the weight melting off. It was just coming off. And so what they then decided to do is to study the drugs in an obese population that doesn't have diabetes and say, does it still work? Does it cause any problems with blood sugar or anything like that? And in fact, not only was it highly effective at getting the weight out, we're getting some really compelling data that this drug in diabetics and non-diabetics can also change their cardiovascular outcomes. So, we're keeping people alive, we're preventing heart attacks and strokes, and more importantly, we're getting that weight off, which can be really something that in the past we've had patients struggle with on their own without offering them medical options that are safe and effective like we have now.
Now, is it important to do, exercising and eating? Because I know with a lot of these, appetite suppressants, things like that, you have to still do the diet portion, right? What about this? Do you still have to eat healthy? Do you still have to work out, or is it just melting off?
I would say the drug works even if you're not eating healthy and not working out. It's really across the board that people are losing a fair amount of weight, 15 to 20% of their body weight. So it depends a little bit where you started off, but you can imagine that's a substantial weight loss. But, if you're trying to do a weight management drug and you're reaching for a drug, that really should be part of a comprehensive diet and exercise program. Because what we don't want to set up here is to start eating unhealthy and then use the drug as a way to make up for eating unhealthy. Because at the end of the day, what we're trying to do is to give you a better quality of life and quantity of life. But if you're not eating a good diet and doing many other adverse things, we're not entirely sure that the drug is actually going to, in the long term, reduce your risk of heart attacks or strokes, because that bad food and the sedentary lifestyle can actually substantially increase those cardiovascular risk factors.
So right now, it is on for, is this being used for weight loss management yet? It is.
Yes, it is. And it's incredible. Yeah. I mean, I cannot get enough patients on this drug because it works really, really well. It's reasonably well tolerated. We can talk about side effects as well. And it's a once a week injection medication. And people are really seeing sustained weight loss coming on within a few weeks of using the drug. And when they stick with the drug, then it just kind of keeps the weight off.
And let's talk about side effects a little bit. I know some of these are still being studied, right?
Yeah, well, we feel like the drug is very well tolerated. So basically what it does is it increases that satiety signal, right? And so it makes you feel full after you eat because it changes the way that your brain and your stomach and your hormones are released. But what that means is that when you first start it, you can have a little bit of nausea. In fact, that is the most common side effect that people experience. And so when we start this medication and it's been FDA approved for weight loss, we do a slow dose up titration. So we start at a very small dose, give your body a chance to sort of get used to it for a few weeks, then go to the next dose, and then get you to the target dose over the course of several weeks. And if somebody's having more nausea, then you would perhaps even go slower, or you may not even end up pushing them up to the target dose, because even at lower doses, you can start to see some of those beneficial weight loss effects. But once people's bodies sort of get used to it, so to speak, It really doesn't cause a lot of side effects. It's a small little injection you give yourself at home. So you just have to be comfortable giving yourself that injection. Now, with people that have been using it for some time, what we hear from patients is that if they end up overeating or really gorging themselves on food, they actually physically feel ill. They can feel nauseated, they can have vomiting, they can even have diarrhea because their brain and their body has been reprogrammed, so to speak, to just have, a different set point for how much food that it needs and when it feels like it's full. So overeating can be a little bit hazardous when you're on this medication.
And do we know any long-term side effects yet? You were saying once you are on this, it's kind of like you don't get off of it, right?
Well, we're still trying to figure that out. So, at this point, the medicine has been designed for chronic weight management. So the idea is to get on the medicine and really sort of stay on it to help keep that weight off because maybe your set point's a little bit higher. Now, we don't have a ton of information about what happens when people use it just for a few months at a time for an event or, to do a diet and then stop it. Do they end up gaining that weight back? We think probably they will. In terms of long-term safety effects, though, we have now cardiovascular outcomes trials for several years worth of data that are showing that the drug is, very safe and very well tolerated. In fact, there's new emerging data that taking these medications can also kind of reduce your ability to drink alcohol as well. And so now they're looking to see whether this may be a way to get people who have, excess drinking behaviors as a way to change that behavior as well.
Really? So it would like help with alcoholism, maybe just you not feeling good drinking it, or how would that work? Yeah.
That's exactly right. Yeah. So this is not an FDA approved indication right now. The indications are for diabetes and for weight loss, but it's currently under investigation whether or not it may be able to modify alcohol drinking behaviors, especially if they're excessive alcohol drinking behaviors. So, in the past, when we've used weight loss drugs like fen-phen and such, they've actually caused adverse reactions. They've caused bad things to happen in other systems of our body. But the really amazing thing about this class of medications is that it helps your metabolic profile. It helps you lose weight, which actually then turns into helping you to get rid of all the weight-related conditions that you might have. So it creates a domino effect where it can help your blood pressure, it can help your sleep apnea, it can help your cholesterol, it can help all the things that are related to having excess weight on us. So we really think that it's an important medication as part of a comprehensive cardiovascular preventive strategy, particularly for those patients who have been struggling with obesity. And we've just left it untreated in the past because all we had to offer them was diet and exercise and do your best. And if they can't get the weight off with that, then that's it. They only have surgical options. But now we have this really great, medical option that I think people have to start talking to their doctors about pursuing.
Okay, so let's talk about insurance and if it covers it and all of that, because I've seen so many different things on social media that this can cost like 1,200 to 1,500 per shot. What is the cost? Is it covered by insurance for obesity yet, or is it just for diabetics?
So many insurances will cover it for obesity. Now, it depends specifically on your individual plan. So maybe worth talking to your doctor or calling that number in the back of your insurance card and asking them if this class of medications is covered. In general, to get insurance coverage, it can't be everybody who wants to lose weight. So you either have to have a body mass index greater than 30, which is a BMI that technically puts you in the obese range, or you have to have a BMI greater than or equal to 27, which is the overweight range, with at least kind of one medical condition as a result of obesity. So high blood pressure, high cholesterol, sleep apnea, what have you. So those are sort of the criteria, the indications for people who would get covered in an ideal world. But coverage very much depends on formulary. So there's many different types of companies that are making these medicines. So it may be that one company is covered by your insurance, whereas the other company isn't. So talking to your doctor about a weight management plan and incorporating this medication into that weight management plan, and your doctor would be able to advise you, which ones they might want to try for insurance coverage. But absolutely, it's an expensive medicine. It's an injection medicine. So this is not something that most of us can do, out of pocket for. But if we have those conditions, we're obese over 30, or we're overweight with a BMI of 27 and some health related conditions, we can actually get our insurance companies to pay for this.
Wow. And then the other question with that is, are they making more of this medicine because people are getting on it for weight loss and it's really intended for people with diabetes? Is anyone concerned that, you know, it's taking away from people who really need it for diabetes?
You know, I would say it a different way. I would say it's not intended for diabetes anymore. It's intended for diabetics, and it's also intended for people who need to lose weight, who are obese, or those who have health related conditions as a result of weight. So I want us to change the paradigm about this. The problem is there have been supply chain issues, because as these medicines have been FDA approved and the insurance companies are now covering them more, the uptake has been dramatic because the results are so impressive and so dramatic. So there have been some of these medicines that have been back ordered. And sometimes if one medicine from one company is back ordered, you can do a substitution or get, you know, the same class of medicines from a different manufacturer. So don't let that discourage you. And also don't feel like you need to put off starting this medication because you're trying to save it for diabetics. I think we need to change the way that we're thinking about treating obesity, which is a significant chronic health condition. I mean, 4 out of 10 Americans are obese, and the impact of the obesity epidemic on our health cannot be, you know, overstated enough. So I feel like we really want to not think about saving the medicine for diabetics. Get us on it, get it started, and talk to your doctor if there's a shortage of the one that you're on, if you need to switch to a different one.
Great, perfect. What else was I going to ask you? Is there anything else that you want to add? I do want to say, though, for people who are watching this on YouTube, that there is a long list of different types, right? We're obviously not saying one or the other because there is such a big list. But you were saying that there are a handful of these, in I guess, companies, medicines.
Yeah, so these medicines are approved for obesity. There's a bunch of them. The thing to remember and ask your doctor is GLP-1. Just ask your doctor, would I qualify for a GLP-1? And that'll open that door for the discussion. And then your doctor can decide based on your insurance coverage, based on your medical conditions, which of the GLP-1s might be best. If you have diabetes, they might pick the GLP plus the GIP, which is a new medicine, a class of medicines that has just come out with 2 different medicines in it. So just to open this discussion by saying, I've got some extra weight on, and am I a candidate for a GLP-1? And that'll really help kind of set off that alarm bell in your doctor's head if it's something they haven't thought of, which a lot of, you know, primary care doctors have so many things on their plate that this is something I want us as patients to embrace and ask for, because it's a preventive therapy. It's a therapy that's going to change the trajectory of our life. It's going to change how we look, how we feel about our body, and our health, and what our outcomes are going to end up being.
Perfect. Great. Anything else that you want to add?
You know, I would say that don't ever feel like shameful if you have extra weight or you're obese, because it's a medical condition. We don't feel shameful if we have diabetes or high cholesterol or what have you. So we really need to start thinking about excess weight in a different way. And if you've hit a wall with losing weight, that's a failure of the medical system. And we need to do better as providers to provide you with more options to help you get that weight off, help you get back to a healthy weight. So don't ever think of it as a personal failure. But again, remember that it's not just a magic pill. It's the magic pill plus all the effort that you're going to make with your diet and lifestyle changes to get that weight and to keep it off. Otherwise, you're going to undo the effects of the medication.
Perfect. Great. Awesome. Thank you so much. I really appreciate it.
Thank you. Thanks for having me. Have a great afternoon.
Yeah, you too.
Take care.
Bye.
Thanks. Bye.